Happy Friday, Baylor College of Medicine and our extended family, friends of Baylor College of Medicine. Once again, interesting week, lots to report on. I'm going to start off with our local information. It's been a pretty good week, a bit confusing. Our effective reproduction number is still under 1, that's a good thing. Our test positivity rate has been below 5%, actually dropped to below 4% for the first time. The strange thing continues to be the number of daily new cases we have, which jumped up to about over 1,500, 1,600. And this has caused a fair amount of consternation because we're very dependent upon that new case number, in part for the calculation of our reproduction number. But also remember, that's one of the metrics we think is really important. We want to get that back down to under 200 or below 10 per 100,000. That's our goal. And the problem is that we're dependent upon the state reporting that information. And as I mentioned last week, the state has had problems because they have 600 different sources of information. They get it all, and they've been reporting it out in sort of big batches. And so we don't have a good handle on when was the test actually done. A lot of times it's reported as when it was reported. So guess what? Bloomberg News had a reporter somehow learn all this, and so our state reporting data ended up being a national story. New York Times picked it up, Bloomberg Times, like somehow we're totally dysfunctional. And we're not totally dysfunctional. I would argue we're only semi-dysfunctional. So if you remember the famous 5-point plan for what we would do in the future, the first and foremost was, how do we manage data? And this is a classic example of why we need that. So if you'll recall, I mentioned that we need to have integrity of the data, we need to have governance structures around the data, we need to be sure that we can get local data that rolls up to the city, county, state, and eventually the nation. Every single superintendent who's trying to figure out what to do with their schools is asking, well, what's the new infection rate? Because we're supposed to be following that, right? Well, we can't really tell them because when we get it down from the state, we have to figure it out. So we've got to do better than that. Now, we have been in contact with the state, and the state is going to try and help us sort this out. So I'm confident going forward that we'll begin to get more data from the state that is more aligned with what we want, which is when was the test done and what happened. When you have a giant backlog that comes in and we don't know when the test is done, we clearly were underestimating the peak of the problem months ago, and we're clearly overestimating the problem now because we're still getting these results in that are probably 2-3 weeks old, and as the New York Times and Bloomberg reported, could be as old as a month or 6 weeks or even 2 months. So when we're trying to make real-time decisions, it's very hard to do that when we're getting data that might be a month old. And that's somewhat reflected. I don't like to, I've talked about using hospitalizations, but if you take away the new case data, we know how many people are coming into the hospital. And the interesting thing is that's continued to come down. So it really makes us believe, and I think everyone understand, that state data probably is a lagging indicator. And the good news is that if you look at daily hospitalizations, they're almost back to what they were in early April and May. The problem is, and I don't know what the trend is, but it's beginning to tick up a little, which makes me concerned, of course, that we will actually begin to see the impact of Labor Day. So we are going to find that out soon enough. Hopefully we will avoid the worst, but we certainly are understanding that it could happen. Now, I do want to talk a little bit about lifestyle issues because my lifestyle is severely attenuated. I used to go out to restaurants and bars like almost every night. Well, let's say restaurants, I won't say bars. And I traveled, weekly on commercial airlines. And so, what is the evidence that we can begin to do that? We all want to go back to normal. Well, the Morbidity and Mortality Weekly Report, this is called the MMWR, it comes out of the CDC, is a very good sort of ongoing analysis of what's going on in the pandemic. And they took about 154 cases and 160 control patients and did an intense questionnaire for those who actually had tested positive for SARS-CoV-2. They asked what activities that happened in the past couple of weeks. And not surprising, I guess, but if you had visited a restaurant or a bar, you were, in the last 2 weeks before testing positive, you were significantly at risk. You were significantly higher. Unfortunately, they did not sort out dining inside versus dining outside. That still needs to be looked at. I'm pretty sure that would be a big difference because there hasn't been a lot of outbreaks in outdoor activities. But still, when people take off their masks while they're eating and talking, it's a pretty high risk. Those achieved high significance. What did not achieve high significance but was suggestive, and they didn't talk about this too much because it wasn't significant, but gyms were pretty close to being significant, as were church and religious gatherings. And so I have mentioned this in the past. I wouldn't walk into any place where there was a large congregation of people, whether it's in a gym or a religious setting. I know there's some people who feel that I shouldn't be saying that, but the fact of the matter is there is, and it looks like there's some risk to that. Now the second thing is, I've been really looking at airplane travel. There has not been a lot of outbreaks, or let me rephrase that. There have not been any established outbreak in the era of mask wearing. There have been pretty good examples of outbreaks, not only of flu, but of coronavirus, so COVID-19. There was one in a Korean airline report of a bunch of people who were being evacuated from China coming back to Korea, and there were some, 2 or 3 cases. One of the most interesting cases was a JAMA paper that came out this past week, where 102 people on an airplane going from Tel Aviv to Frankfurt. None of these people wore masks. It was a Boeing 737-900, in case anybody's interested in flying airplanes. And 24 of these people were in a tourist group. And they apparently were exposed to a hotel manager who was COVID positive. And sure enough, on the plane there were a bunch of cases that developed. And what you can see is there was a cluster of folks who were clearly positive, had tested positive. And about 2 aisles apart and across the aisle were 2 cases that were likely transmitted during the flight. None of these people were wearing masks, and there's 2 ways of looking at this. I look at it kind of positively because they weren't wearing masks. The airflow in this particular plane goes from ceiling to floor and from front to back. And these lucky 24 tourists were in the back of the airplane, which is why I would suggest never going on a tourist group, ever. But if you happen to be on one, with one, they were all stuck in the back, and 2 of the tourists got sick, probably from a transmission from the known 6 or 7 index cases. But the entire plane didn't get infected. So, I view that as kind of at least some positive examples because of airflow and some of the precautions taken. If you wear a mask, so far it looks like there hasn't been a lot of outbreaks on commercial air traffic. But I think commercial air traffic's in trouble for other reasons, and the main reason is the new 4-letter word, which is Zoom. So now that most business is being conducted in Zoom meetings, and business people figured it out that this saves them a whole lot of money and time not traveling. I think even when commercial airline traffic comes back or it becomes safe, that business segment is going to be pretty significantly lost, and it's going to be interesting to see how airlines do, because they need help, and the business dollars have been the ones that have really been supporting them, and that is going to be significantly impaired, I think, going forward, no matter what. And amazingly enough, Lily is now digging away at the door to see if she can get in. Come on, Lily, we never exclude her before, so I'm not really sure. She's sitting there going, what about me? What do I, chopped liver? Hi, Lily, I'm sorry about that. Don't make so much noise. The last thing I wanted to mention is I had talked about this one case of reinfection in Hong Kong. I think it was a couple of weeks ago. And there's now a second case. And they're both clearly shown to be second infections because they sequence the virus. And the interesting thing is both reinfections were very, very mild. And so I think, you know, there's two ways of looking at it. You can say, oh, geez, it's unfortunate that the immunity didn't last forever. But coronaviruses, we have never experienced immunity that lasts forever. We get the common cold all the time. And it's kind of encouraging that the second infection was actually extremely mild. So I think that there's pretty good evidence that once we get a vaccine that's effective, it's going to reduce at least the severity of the infection to, I think, reduce morbidity and mortality substantially. The real issue, though, will it prevent transmission? We still don't know that. We won't know until the trials are done. So anyway, lots of good news, I think, from the COVID world. We seem to be managing pretty well. I think we haven't opened up schools yet for face-to-face teaching, but my impression, except for the state data, it looks like we're having a significant reduction each day in the number of cases. And I think we're going to be able to begin to open up and do more activities as long as we remember that masks are going to be in our future for the next year. So lots to think about, but a pretty good week in general. I'm very optimistic about how things are going. The school's never been doing better. So I'm really thrilled about how we are doing. But of course, that's our faculty, that's our staff, our learners. The reason we're doing well is because of you, and that we have leadership at the top like Lily. I think as long as Lily's here, we'll be okay. So anyway, have a great weekend. I'm planning on relaxing, as I've encouraged many of you. It's crazy to be, or you get crazy when you're stuck in your house doing nothing all the time. A little shout out to Dr. Asim Shah, who gave a nice discussion to the city and the county about mental health. And what he said was he wanted to change the words from, he didn't want us to use social distancing anymore. And I think he's right. I think what we want to say is we need to be physically distant, but not socially distant. And I encourage you all, think how you can be socially connected, but remain physically distant with your mask. So have a great weekend. I look forward to getting together next week with you all. Bye-bye.